Ambulance companies across the country have been heavily impacted by the pandemic. Truly at the breaking point. In a letter obtained exclusively by NBC News, the American Ambulance Association told the Department of Health and Human Services, the 911 emergency medical system throughout the United States is at a breaking point. Without additional relief, it seems likely to break even as we enter the third surge of the virus in the Midwest and the West. Joining us now, Chief Medical Officer at the American Medical Response, Dr. Ed Racht. Doctor, thank you so much for being on this morning. Can you describe the situation that the ambulance companies are facing?
Absolutely. Good morning, Mika. EMS, the ambulance services industry, through this entire pandemic, as the country knows, has been at the front of that front line. So the 911 calls, moving critically ill patients from one hospital to another, and that workforce has done a tremendous job. It's been done in a very challenging environment, and we are worried, we are more than worried, that the sustainability of that approach is in jeopardy.
And can you describe the scenarios that they are facing in terms of manpower, in terms of what they're seeing on the front lines, and why we are in this situation now today?
Yeah, it's an interesting collision. It's the perfect storm if you look at medicine and emergency health care. So you have an evolving pandemic, a critical infectious transmissible disease that spreads nationwide. It affects the providers themselves. So there is a tremendously enhanced protection mode, personal protective equipment, training, appropriately managing those folks. The call volumes in 911 in communities have skyrocketed given the number of patients. And given that environment, with the changes in all of the economics, not just nationwide in every sector, but particularly in healthcare, the storm that's created is a much tougher clinical environment, a much more challenging operational environment. Healthcare providers, paramedics and EMTs that are frankly getting ill, getting COVID, put themselves at risk with the challenges of obtaining increasingly costly PPE. And you put all that together, and especially at this point with increasing illness burden in communities and hospital saturation, the challenges are substantial. I think what's important is EMS can do this, and EMS has done this. But in order to sustain that effort, being able to finance that component, being able to support the providers, being able to look at regulatory relief to be able to manage communities in an unprecedented pandemic state is critical at this point. And we now know we're worried. EMS as a profession is worried about sustaining that as we move into an even tougher time in this pandemic.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.